More than 24 University of Texas students were infected with COVID-19 after a spring break trip out of the country. UT Austin confirming all 28 who tested positive are students on the 40 acres. As KXAN's Alyssa Gord explains, she tells us why both local government officials and UT Austin are investigating.
Austin Public Health explained this all happened around a week and a half ago when a group of 70 people in their 20s got on a chartered plane for a spring break trip. The plane headed to Cabo San Lucas, Mexico. The group did not, however, all come back on the same flight. Austin Public Health said 28 of those 70 people have tested positive for COVID-19, with dozens more under public health investigation. Those who tested positive are self-isolating, APH says. Others who were exposed are under quarantine while being monitored or tested. When the trip happened, there was not a federal travel advisory for Mexico, but Austin Public Health was using the CDC's guidelines at the time for essential international travel, and they say this trip didn't follow those. While younger people are at a lower risk for complications from COVID-19, nearly half of those testing positive in Austin-Travis County are between the ages of 20 and 40. The city says because this is an active investigation, they can't tell us whether these spring breakers are in Austin now. UT tells me that as of today, 7 of its employees and 38 of its students have either tested positive or are presumed positive with cases of COVID-19. UT also tells me that because classes have now switched online, that almost all of its students have returned either to their homes in Texas or around the world. So if they have cases, they may be reporting them wherever they are. In Austin, Alyssa Gord, KXAN News.
Expect more drive-up COVID-19 testing sites this week in Austin, Cedar Park, Kyle, and Round Rock. Doctors at the Austin Regional Clinic say they're launching 5 testing sites at several of its locations. They'll set up tents outside clinics so patients can drive through for testing. First, you'll need an order from an Austin Regional Clinic doctor. If you drive up without one, they may be able to schedule a televisit in the parking lot. The chief medical officer tells our morning anchor, Sally Hernandez, the goal is to keep up with demand. More people are concerned about symptoms that they think could be COVID-19, and healthcare providers are fielding calls, which have taken up 30 to 40% of their workload.
Any idea of how many people you have tested so far?
So far, we've tested almost 2,100 people. We have 1,100 negative tests. We have 84 positives. And we have roughly 800 that are pending.
The doctor tells us those numbers are reflective of all 28 Austin Regional Clinics spread out in 12 cities. Yesterday, we mentioned that ARC switched the private lab it uses for testing after we heard from 2 patients who had been waiting more than 9 days for their results. Here's something else that we found interesting. Of the 84 positives he mentioned, 57 were among people between the ages of 30 and 60. Only 11 positive results were people older than 60. Dr. Zadunek says that may show the most vulnerable and older age group are taking social distancing seriously.